Up to 500 people are at risk of dying every week in the United Kingdom due to delays getting access to emergency care. The National Health Service is now facing a situation considered worse than at the height of COVID, amid calls for the government to take action in the social care sector.
In Sheffield, the strain of the social care sector is all too apparent. This is one of many care homes counting the cost of staff shortages and soaring bills. Using agency staff is necessary, but expensive, as energy and food costs are rising along with interest rates. It's a time of apprehension about how round-the-clock care can be provided.
We've seen staff leave the system through the pandemic. We can't recruit like we used to be able to recruit. We're not competitive with the pay rates. They're doing a fantastic job within our care facilities, within the trust. But sadly, we're not competitive.
Fighting their corner is the Archbishop of Canterbury, with a New Year's Day message advocating for urgent action and greater funding.
Our care system is broken, but it doesn't have to be. We can rise to the challenge of fixing it. That means action from all of us, you, me, families, communities, government. Caring goes to the heart of what it means to be human. It is hard.
Justin Welby wants carers to be valued more and paid more. He's highlighted how less demanding jobs can be more lucrative, adding to the staffing shortfall. There were 1.79 million posts in adult social care in England last year, but only 1.62 million were filled, a decrease of 3% on the previous year, leaving 165,000 roles empty, and the number of vacancies is only growing year on year. Boris Johnson promised to fix the crisis in social care after entering Downing Street in 2019, but the implementation of reforms has been delayed by political and economic upheaval. £7.5 billion extra has been made available over the next 2 years for adult social care in England. Greater provision of care that's needed so thousands of patients can be discharged from hospitals to reduce pressures on the wider NHS, as there's a new warning that 500 people a day could be dying due to emergency care delays.
No doubt whatsoever that hundreds of patients are dying unnecessarily every week because of what's going on in the urgent and emergency care sector. So several hundred patients, and those are all human beings. These are more than just statistics. And I think we have to be honest about that.
Underscoring why calls are growing for the priority in 2023 to find financial solutions to ease the burden on the NHS.